Good afternoon, students. Today I will be discussing about the emetics. I am Shipra Shakar Banerjee, Assistant Professor of Brainware University. I am discussing the topic for B Farm first year. Now, what is emetics? Actually, emetics is derived from the word emesis, which means vomiting. Vomiting may be defined as the forceful expansion of the contents present in the stomach through the mouth and sometimes through nose. Now, definition we can get. Emetics are the agents which administered orally or by injection induce or evoke the vomiting. Sometimes emetics are added in the cough preparation in low doses to stimulate the flow of respiratory tract secretion. Emetics are also used as mechanical antidote that are given before absorption of poison into intestine or absorbed in blood. So patient expel out the toxic substance. Most of the salt in higher doses act as emetics. Now, mechanism of action. Emetics generally act by two ways. One, by stimulation of chemoreceptor trigger zone that is located in the area of posterior medulla oblongata in brain, or by refluxly producing irritation on GI tract, that is copper sulfate, sodium chloride, zinc sulfate, antimony potassium tartrate. Commonly used emetics are salt water and mustard, inorganic salt, induce antimony potassium tartrate, zinc tartrate, and copper sulfate. The common side effect of emetics are dehydration. So the patient must be kept hydrated. Next. Now, contraindication. Expectorant should not be used in conditions like significant CNS depression and shock, patient with severe heart disease and tuberculosis, and a hernia in advanced pregnancy. That means if the patient having this type of disease, they should not be given the emetics. Now coming to the copper sulfate. So the molecular formula we know very well, that is a CuSO4 5H2O, that is known as generally blue vitriol. A molecular weight is 249.7 gram and it is known as a cupric sulfate. Standard, its cupric sulfate should not having the limit not less than 98.5%, not more than 105%, calculated with reference to the dried substance at 250 degree. Method of preparation. The preparation of copper sulfate employs two-step reaction. In the first step, copper granules are heated with sulfur. A mixture of copper sulfate and cupric oxide is obtained. The resulting solution then filtered to separate copper sulfate crystals. Now, in the second step, the residue, that is the copper oxide, cupric oxide, is again treated with dilute sulfuric acid to convert it to completely into the copper sulfate. Like we have given the reaction Cu plus S, that is converted to the CuSO4 and then plus CuO, then it is again hydrated with to produce CuSO4 and H2O. Now coming to the physical properties. It exists in the form of deep blue crystals or pentahydrate available in the form of granules or powders. It shows evaporations in dry air slowly. It is soluble in water, very soluble in boiling water and insoluble in alcohol. It is acidic in nature and changes blue litmus later. Name chemical properties. On heating to 100 degree, it loses 2 molecules of water. At 40 degree, another molecule of water, and at 200 degree, white anhydrous salt is formed. That means total water molecule is dehydrated. See the CuSO4 5H2O. At 100 degree, it becomes CuSO4 3H2O and 2H2O, and then at 140 degree, it becomes CuSO4 2H2O. At last 200 degree centigrade, it becomes CuSO4. At very high temperature, it decomposes to cupric oxide and sulfur oxide gas. CuSO4, that is the CuO plus SO2 plus O2. Now, identification test. The 5% W/V solution of sample of cupric sulfate is tested for copper and sulfate. Test for purity. The sample of copper cupric sulfate is tested for the presence of the following impurities in the prescribed limit, like chloride not more than 100 ppm, iron should not be more than 10 ppm, lead not more than 50 ppm, and loss on drying not more than 36.5%. The storage condition, that is it must be protected from air, heat and moisture. Incompatibility means that it has been incompatible with alkalis, phosphate, propylene glycol and sulfur thiazole. Uses. It is used as an emetic, but in large doses it is corrosive in nature. It is considered as a chemical antidote in phosphate poisoning. It is an ingredient of Benedict's and failing reagents also. Now coming to the sodium potassium tartrate, that will be discussed in next class. Thank you all.